Hi, my name is Shannon, and in order to complete my perceptive and perception speech, I selected nursing as an occupational perspective and interviewed a good friend of mine, Justine Johnson, who is a graduate from Creighton University and is employed as a nurse at Mayo Clinic in Minnesota. From the interview that I had with Justine, I gained a lot of valuable information regarding the perspective I chose in order to complete my speech on. Throughout my speech, I will be talking about three main points: socioeconomic status, culture, and conflict. When working in a hospital, as a nurse, you will interact with patients from all different kinds of socioeconomic statuses and social class backgrounds. Creighton University Medical Center takes patients not considering whether or not they are able to afford the medical care that they receive. Many of these patients are homeless and are uneducated. Where Justine completed her preceptorship at Bergen in Omaha, many of these patients were educated, middle class, and able to afford their medical care costs. The elements of socioeconomic status that may be significantly different than my own may include income, education, and social habits. It just kind of depends on who the patient is that I am working with. Justine gave me this example that relates to some aspects of socioeconomic status she has encountered that were different than her own but have impacted her greatly. When first dealing with patients who have different social class backgrounds than herself, she felt at times oblivious to the things that they could be facing in life. Justine grew up in a middle-class family who was able to enjoy some of the luxuries of life. Because of this, she found it difficult to believe that some of these people could not afford homes or some of the basic medical needs. In addition to interacting with patients from all different kinds of socioeconomic statuses, as a nurse, patients in whom you interact with will also come from a variety of different cultures. At Bergen, most of the patients who Justine interacted with were Caucasian, while many of the patients who she interacted with at Creighton were from a variety of different cultures. It really just depends on what hospital you are working at and where you are located geographically on the types of patients who you will be interacting with. Some will be similar to you, whereas others will be different. Because it is possible to work with patients that come from a different cultural background than your own, the common barrier that I will find myself being faced with the most is the language barrier. Other than accommodating the language barrier, Justine has not faced much experience working with vastly different cultures. However, in some situations, age, gender, and religion will need to be taken into consideration. Justine provided me with this example. Justine cared for a young girl who was from Haiti that suffered from a severe spinal cord injury. To communicate, Justine and her patient used a blue phone in which the interpreter was put on a speakerphone, and Justine and her patient were able to speak and their words were translated. In addition to the language barrier, this patient's mother also loved to cook for her daughter. The staff and Justine always encouraged this patient's mother to bring whatever she needed and however much she needed, because this is what the patient liked and this is what she believed would heal her because of the nutrition that was in the food that her mother was making. Learning opportunities will be created through experiences such as this, which might make Justine's job challenging at times, but also very, very rewarding in the end. In a hospital setting, it will not be uncommon for a nurse and patient to have conflict. A patient and nurse may have conflict due to different values, goals, beliefs, etc. Most of the time, you will always have opposition with your patient. For example, sometimes you may be dealing with patients who do not want to take a shower, who do not want to walk, or may not want to practice their breathing treatments. In situations like this, it is very important to explain the benefits to your patients as to why certain things need to be done in hopes that you can persuade them to listen to you. Sometimes you will be placed in a situation where you will have to tell your patient no as an act for looking out for them in their best interest. However, it is also important to listen to them and respect their goals and wishes and accommodate them to the best of your ability, especially if they are beneficial to your patient. In conclusion, I have talked about 3 main points about my perspective that include socioeconomic status, culture, and conflict. The one thing that I especially want my audience to take from my speech is that nursing is a broad perspective where I may see something different than Justine sees something, or another nurse may see something completely different or from a different angle. It is also important to remember that perception is a big factor in the nursing field.